Hello and welcome to TTV. You're watching Fighting COVID. When we talk about the pandemic, Oman has come a long way from seeing a huge surge in the number of daily COVID cases, deaths, hospitalizations, ICUs in the months of May, June and July, reaching to thousands of daily cases to now ranging between 2 digits of cases, hospitalizations and 1-digit deaths, all thanks to the tremendous efforts put in by the respected authorities in the country and controlling the situation what looked like slipping away just a couple of months ago. Needless to say that the determination shown by the relevant authorities, including the Supreme Committee, Ministry of Health, health officials, Royal Oman Police, just to name a few, has helped the country to come out of the dark age when the Sultanate was under partial lockdown, commercial activities were halted, airports were closed to 18 countries, including Pakistan, India, Bangladesh, Sri Lanka, Philippines, and many others. Borders were also closed to the neighboring countries, halting of social and cultural events, to now the country being open to and for all, keeping in mind the precautionary measures that still needs to be adhered by the people. If you all remember that yesterday, several decisions were taken place by the Supreme Committee, further easing the accessibility and lifestyle in the Sultanate. Just a quick recap of the decisions. The Supreme Committee decided to stop the decision to apply institutional quarantine to those coming from Iraq and Iran. Friday prayers to be held and to reopen places of worship for those who have received at least 1 dose of a COVID-19 vaccine until the end of September 2021, provided that the number of attendees does not exceed 50% of the capacity of mosques. Participation in religious, social, cultural, and sports activities and events, exhibitions, and conferences for those who received at least 1 dose of the vaccine until the end of September 2021. Once again, provided that the number of attendees does not exceed 50% of the capacity of the halls and sites. Moreover, Oman's efforts to provide COVID-19 vaccines to its people in a smooth and efficient manner have also been praised by Dr. Tedros Ghebreyesus, the head of the World Health Organization. During his visit to the country recently, he also visited the Oman Convention and Exhibition Center, which is the main vaccination hub in Muscat. Millions of doses have been administered to people who visit the center to get inoculated against COVID-19. In addition to that, His Excellency Dr. Ahmed Mohammed Al Saidi, who is the Minister of Health in the country, has affirmed that the epidemiological situation of COVID-19 pandemic in Oman is improving continuously, attested by a steady decline in the number of new infections and deaths. Speaking about the vaccination process in the Sultanate, the minister said that 92% of Omanis received the first dose. He added that the combined percentage of vaccinated citizens and residents stood at 74%. The minister hoped that by the end of this month, 100% of Omanis will have received the first dose, and that by the end of next month, which is October, 100% of Omanis and residents in the target segments will have been fully vaccinated. The minister hailed the efforts of all health workers and supporting parties. He also thanked citizens and residents for their commitment to COVID-19 precautionary measures. Dr. Ahmed urged all those who have not received the vaccine to come forward and get vaccinated as soon as possible. He exhorted all individuals, government and private establishments to abide by the health procedures. He also underscored significance of abidance by COVID-19 precautionary measures as a prerequisite to the full opening of all activities. Talking about vaccination and keeping in mind the resumption of schools in phases or batches, the Directorate General of Health Services of Ad-Dahira Governorate announced recently that the vaccination of school students between the age of 12 and 17 with the second dose of COVID-19 vaccine will be started in the Governorate schools this week. With that, it's time for a quick commercial break, but stay tuned as we'll be talking about the US Food and Drug Administration, commonly known as FDA, panel votes against widespread COVID vaccine boosters, no PCR test to enter Abu Dhabi, and much more.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to Fighting COVID. So last week, a US federal advisory panel made up of a team of experts rejected a plan to give COVID-19 booster shots to most Americans. Members of the panel expressed concern over the lack of data from Pfizer over the safety of administering the extra doses, especially for younger age groups. The vote was 16-2 against the extra shot for people 16 years old and up. The panel also had doubts over the value of mass boosters. During a second vote last week, the panel backed booster shots for people who are over 65 years old and others who are deemed to be at high risk. The rejection of the panel is a knock to the Biden administration's campaign to offer boosters to most Americans. Now you may wonder, what did the panel of experts say? There was a level of concern among the experts over the necessity of giving a third shot to younger Americans. Dr. Cody Meissner of Tufts Medical Center said he was worried about extra doses being administered to younger age groups, considering the risk of heart inflammation seen in younger males after a second shot. On the other hand, Dr. Paul Offit, who is a vaccine expert at the Children's Hospital of Philadelphia, was more willing to support a third dose for those over 60, but he said, "I really have trouble supporting the added jab down to age 16. Moreover, Dr. Amanda Cohn felt the emphasis should be placed on those who had yet to be inoculated. With this, the White House vaccine plan takes a knock. In August, President Joe Biden announced a plan that would see every adult American receive a booster shot 8 months after receiving the second jab. Biden said the extra measure would make Americans safer for longer. The plan, however, is on the ropes, with leading scientists questioning the sense in providing boosters at this point in the pandemic. Earlier last week, FDA vaccine reviewers joined prominent international scientists in a paper which rejected extra shots in healthy people. The FDA must now make a decision based on the expert panel's recommendations, which will be expected in the coming days. However, it's not just the FDA that needs to sign off on Biden's vaccine plans. Booster shots also need to pass the scrutiny of the Centers for Disease Control and Prevention. Now from the UAE. PCR test is no longer required to enter Abu Dhabi Emirate starting from September 19, which was yesterday, the Emergency and Crisis Management Committee in Abu Dhabi has announced recently. The decision comes after the announcement of reduction in the infection rates from COVID-19, which has come down to 0.2% of the total population in the Abu Dhabi Emirate. The implementation of the green traffic system to enter some public places is also expected to come into effect. Now, to protect community members and travelers in the Emirate, Abu Dhabi implemented a Green Pass protocol on August 20, 2021, enabling only those that are fully vaccinated to be officially exempted or under 16 years of age to access key public places and attractions. In fact, in this regard, a statement was issued by the Emirates news agency saying that the committee will continue to monitor the epidemiological situation and urge citizens, residents, and visitors to adhere to precautionary measures in order to ensure the health and safety of community members. This was all from our Fighting COVID studio today. Stay tuned for more COVID-related updates and news next week, same time. Keep watching TTV.